Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through June 17th, 2021. This week, I'll ask the same question that I ask every week. How is the pandemic progressing globally in the U.S. and in our region? And then I'll address a question that came in from a viewer, which is when and how and where should I wear a mask? So how's the pandemic progressing globally in the U.S.? Globally, 3.8 million deaths, almost 4 million deaths, 1.9% increase. That means last week there was 1.9% more deaths than there had been the week before. That's the third week in a row that we've been at 2% or less, which is good news. It means the pandemic has been slowing down. It doesn't mean it won't speed up again, but it has been slowing down. But even with that 70,000 deaths last week, it's over 7 deaths every minute. So while the pandemic may be slowing down, it isn't gone yet. It is still burning out of control, especially in other places around the world. This is a cumulative slide that shows the daily deaths, and the brown line is the weekly moving average. And what you can see is there was this sharp rise in deaths up to about 7,500 deaths a day in March and April. And then it stayed pretty level through the summer, a little over 5,000 deaths. Then it spiked pretty significantly up to 15,000 deaths, dropped in February, March, came back up again and dropped again. Of course, what we don't know is, will it go back up? Will it continue to drop? But even at this point, it's important to point out that we're still seeing more daily deaths over the course of the beginning of the pandemic or through the summer. Really, the only times we've seen more deaths were in the spike in the winter and the most recent spike. If you look at all the countries in the world that have had over 1,500 deaths per million, that's one death for every 677 people. There are now 22 countries in that, and there's the U.S. at 15th. In the U.S., we've had over 616,000 deaths, and about a 0.4% week-to-week increase. So we're definitely seeing a slowing down in the U.S. And again, early on, we were seeing 80 to 85% increase. Then it came down, fluctuated in the 4 to 5% range and went up and down, up and down. This is now we've had several months now with less than 1% increase, which is really good news. But even at that 2,600 deaths last week, and that's 375 deaths every day. 15 deaths an hour. If you look at our pattern, we've seen the same thing we saw in the world, the spike back in March and April, then fairly level through the summer. We saw a little bit of more of a spike in the summertime than other places did. And then this huge spike in the winter. We did not see the second spike here a couple of months ago that the world has seen. In fact, we've seen a pretty progressive drop in the daily number of deaths, such that it's now lower than any time that we've had the pandemic since the very beginning. But it's important, I think, to reflect on what does 616,000 deaths really mean? Well, if you look at the number of heart disease deaths, that's the leading cause of death in the United States. We're not quite at that level yet. If you look at the number of deaths from the Spanish flu, we're getting pretty close to that. Look at the number of cancer deaths. We actually have had more deaths from COVID so far than we normally get in a year from cancer, which is the second leading cause of death. And in fact, we've had more deaths from COVID than in any given year we have from injury, stroke, diabetes, and Alzheimer's disease combined. If you look at the population of several major cities, you can see that we've lost about the equivalent of the population of Louisville, more than Milwaukee, Baltimore, Albuquerque, and considerably more than the population of the Tri-Cities. So while the pandemic is slowing down, we have to look back at this and say this was a very serious event that caused significant death in our country. And it's not gone yet, and it may recur. So we have to continue to be cautious and treat this pandemic with the respect that it deserves. In terms of the 21 county ballot service area, we've had 15 deaths in the last 2 weeks. It's definitely slowing down for us, as you can see. And the number of hospitalizations now is well below it has at any point since the ballot began reporting it. But even at 32 hospitalizations, you realize that's still not an insignificant thing if you think of 32 people in the hospital because of COVID. So while it's definitely slowing down in the US and in our region, it appears to be slowing down globally. But the history of what we've seen of this going up and down should make us pretty cautious about making any very strong statements about the future of the pandemic. Let's wait and see what's going to happen. The question, when and where should I wear a mask? It's pretty straightforward. If you haven't been vaccinated, there's different recommendations than if you have been. If you haven't been vaccinated, then you should wear a mask when you're in public places. You should wear a mask when you're around someone at high risk. And of course, you should wear a mask if you have any symptoms, and you should be tested. On the other hand, if you've been vaccinated, according to the CDC, you can basically resume most activities you did prior to the pandemic, except where there are specific local laws or requirements by local businesses, particularly related to transportation, healthcare, criminal justice settings, and so on. But you should wear a mask if your healthcare provider suggests it based on your health conditions. And of course, if you have symptoms of COVID-19, you should wear a mask and be tested. Personally, I like to wear a mask if I go into a business that requires the employees to wear a mask. If they feel that they have to wear a mask, then I feel I should abide by their requirements, recommendations as well. At the end of the day, the question isn't about masks, really. It's about whether people get vaccinated. Please get vaccinated. This is the most important time. If we lollygag right now, and that is a very well-defined public health term, if we wait around, all we're going to see is mutations in the virus. And it's possible, not definite, but it's possible that we're going to see resurgences in deaths, in hospitalizations, in the impact of this pandemic. Hopefully we're not, but it's certainly possible. The best weapon we have right now is vaccination. So the question is, how's the pandemic progressing globally in the U.S. and in our region? And the U.S. and our region definitely slowing down. Globally appears to be slowing down, but still much worse than at many, many months of the pandemic. And then in terms of a mask, it really depends on whether you've been vaccinated or not. A lot more information about COVID-19 on the College of Public Health website. If you'd like to be added to our mailing list and know anyone who would, please contact Jan Stork at that email or that phone number. As always, thanks to Dara Young for editing, producing, and posting this video. And if you have any questions about this, what I've said today, or anything else, please let me know. I try very hard to answer your questions. Many of them I'll answer by return email, but some of them I'll incorporate into next week's update. Until next week, please be well. Thank you very much. Bye-bye.